I've had sciatica for 6 years and I've tried everything in an attempt to relieve the pain. Nothing has helped, including decompression surgery. And to be honest, this is what I found. So I'm an orthopedic expert physical therapist with 17 years experience, 4 advanced certifications in orthopedics. And I have found that all the typical treatments, everything that this person has tried really sets you up for failure. It's a lot of core neutral strengthening, and I talk about why that's wrong in a lot of my posts and podcasts, is that you need movement, right? And that just makes sense, is that protecting something forever isn't going to be the end solution. Eventually, you need to restore full movement in every direction in order to have a healthy spine. But most programs fail to do that really from the get-go and throughout the whole program. And then a lot of the treatments out there aren't treatments, they're just management of your symptoms or temporary pacification of your symptoms, like a hot pack and a TENS unit that really does nothing to treat the underlying cause. And then you'd be surprised on how many other interventions do the exact same thing. A lot of massage, a lot of cupping, trigger point, acupuncture, taping, even a lot of stretching, and then a lot of the medications you get, the cortisone injections, all of these have one thing in common. They do nothing to treat the underlying cause. They do nothing to make you stay better. So the everything that this person's tried, the everything that we're talking about, does fail. So now you need to start doing something outside of that, right? If we've recognized what doesn't work, then we need to talk about what we need to look for, what does work. And for me, what I have found is that just moving in the opposite direction of where you're stuck, figuring out if you're stuck in extension or flexion for your low back, moving outside of that range, and then strengthening in that range. That is what will make you better, but most programs fail to do this.